Today, I'm at the Royal London Hospital with my friend Dr. Shafi Ahmed, who is a cancer surgeon. And in fact, not just any surgeon, but Time magazine actually considers him the world's most watched surgeon.
I've been working to improve education and training, not just in the UK where I work, but around the globe. We don't train enough doctors. We need many more healthcare professionals across the globe. And in my specialty, we need more surgeons. 5 billion people around the world can't access surgery if they need it.
Can we take the technology that I'm interested in, machine learning, and actually combine it with robotics like this to, for example, maybe even do automatic surgery one day?
Which means that I've been teaching surgery, not just to 1 or 2 people around me, but to tens of thousands of people across the globe at the same time. And patients already are now experiencing benefits using virtual reality. For example, patients that have phobias or have anxiety disorders are being helped by virtual reality training.
Today, I'm at the Royal London Hospital with my friend Dr. Shafi Ahmed, who is a cancer surgeon. And in fact, not just any surgeon, but Time magazine actually considers him the world's most watched surgeon.
I've been working to improve education and training, not just in the UK where I work, but around the globe. We don't train enough doctors. We need many more healthcare professionals across the globe. And in my specialty, we need more surgeons. 5 billion people around the world can't access surgery if they need it.
Can we take the technology that I'm interested in, machine learning, and actually combine it with robotics like this to, for example, maybe even do automatic surgery one day?
Which means that I've been teaching surgery, not just to 1 or 2 people around me, but to tens of thousands of people across the globe at the same time. And patients already are now experiencing benefits using virtual reality. For example, patients that have phobias or have anxiety disorders are being helped by virtual reality training.
Today, I'm at the Royal London Hospital with my friend Dr. Shafi Ahmed, who is a cancer surgeon. And in fact, not just any surgeon, but Time magazine actually considers him the world's most watched surgeon.
I've been working to improve education and training, not just in the UK where I work, but around the globe. We don't train enough doctors. We need many more healthcare professionals across the globe. And in my specialty, we need more surgeons. 5 billion people around the world can't access surgery if they need it.
Can we take the technology that I'm interested in, machine learning, and actually combine it with robotics like this to, for example, maybe even do automatic surgery one day?
Which means that I've been teaching surgery, not just to 1 or 2 people around me, but to tens of thousands of people across the globe at the same time. And patients already are now experiencing benefits using virtual reality. For example, patients that have phobias or have anxiety disorders are being helped by virtual reality training.
Today, I'm at the Royal London Hospital with my friend Dr. Shafi Ahmed, who is a cancer surgeon. And in fact, not just any surgeon, but Time magazine actually considers him the world's most watched surgeon.
I've been working to improve education and training, not just in the UK where I work, but around the globe. We don't train enough doctors. We need many more healthcare professionals across the globe. And in my specialty, we need more surgeons. 5 billion people around the world can't access surgery if they need it.
Can we take the technology that I'm interested in, machine learning, and actually combine it with robotics like this to, for example, maybe even do automatic surgery one day?
Which means that I've been teaching surgery, not just to 1 or 2 people around me, but to tens of thousands of people across the globe at the same time. And patients already are now experiencing benefits using virtual reality. For example, patients that have phobias or have anxiety disorders are being helped by virtual reality training.
Today, I'm at the Royal London Hospital with my friend Dr. Shafi Ahmed, who is a cancer surgeon. And in fact, not just any surgeon, but Time magazine actually considers him the world's most watched surgeon.
I've been working to improve education and training, not just in the UK where I work, but around the globe. We don't
Good morning to everybody out there. This is Dr. Don Halverstadt coming to you from the University of Oklahoma Health Sciences Center in Oklahoma City, Oklahoma, USA. I've been asked to open the show for you this morning and to introduce our guest speaker. In opening the show, I would first say that Tanmay needs no introduction to this audience. He has put together a really exciting presentation for you this morning, centered around the effects of technology on the future of healthcare and the effects of the coronavirus on the future of healthcare. The guest speaker that I would introduce to you is Dr. Shafi Ahmed, a well-known, well-respected, highly decorated surgeon from London, England, who's been very active in the digital world. Dr. Ahmed was named by the Time magazine as the world's most watched surgeon. And in order to put that into perspective, let me give you a very brief historical note. In the old days, before modern medicine caught up with the digital technology world, uh, when I wanted to produce something in the operating room to use for educational purposes, um, I had to take a Kodak camera into the operating room and then stop the operative procedure every 10 or 15 minutes to allow the guy with the camera to take a picture over my shoulder. When the procedure was ended, we then took the pictures, developed them into 35 millimeter slides, which were then put into a projector, and it was projected on a flat screen for educational purposes with students or residents or faculty or nurses or whomever. Uh, that process was slow and it was antique, if you will. And then along came uh, uh, Dr. Ahmed, and in 2016, he was quite active in the digital world, quite active in the virtual reality field. And in 2016, he did the world's first virtual operation. And think of what that meant. It meant that innumerable numbers of people could view what he was doing virtually as though they were watching through the surgeon's eyes. Think of the potential impact that could have on medicine in general, healthcare in general, and other ways as well. Um, uh, Finally, I would pose one question for our speakers today that perhaps they will address. And that question would be, um, what will the face of medicine look like in 10 or 15 years, given the fact of the effects of technology on medicine and the emerging effects of the coronavirus on technology, on medicine? With that, I will turn the microphone over to Dr. Ahmed, and thank you for listening.
Thanks so much for that kind introduction, and it's a pleasure and honor to be here and to be introduced by an eminent surgeon with a stellar background as Dr. Halverstedt. So thank you so much, John. And Tanmay, great to be here, speaking again from London, where I work as a surgeon at the Royal London Hospital.
All right. Hello, Dr. Shafi. Hello, Dr. Halverstadt. Now, first of all, before I begin, I do want to say a huge thank you to Dr. Halverstadt for coming on my show and for that beautiful introduction and those remarks. It's really an honor to have you on the show. It's an honor to have you on Tech Life Skills with Tanmay, and thank you very much for being my mentor. Now, once again, everybody, I want to welcome you to the 5th episode of Tech Life Skills with Tanmay. Today's discussion is going to be really exciting. I hope everybody is staying safe. I hope you're doing well. And once again, thank you for joining today's live stream. Now, really the only way that I can describe today's discussion is that I am really thrilled for it. And I'm thrilled because we're going to be talking about some technologies that are amazing in 3 different ways. First of all, they have a huge impact On top of that, not only do they have that amazing impact, they're technologically fascinating. They're amazing to be able to implement, but at the same time, they're cool. They're just amazing technologies to be able to interact with. Now, what else could you ask for? That's perfect. And so, what we're going to do is we're going to touch upon a couple major topics around these technologies. First of all, what kind of like behind the scenes impact has COVID-19 had on the field of healthcare? Things that we might not realize. On top of that, how is technology actually helping us to fight that pandemic from a healthcare worker standpoint? And then from there, what kind of new or next generation technologies are helping us to build that future? Now, we're going to be discussing so much more. And I'm excited to begin our discussion with our special guest, Dr. Shafi Ahmed from London, England. Now, Dr. Shafi and I met back in 2017 at the Knowledge Summit in Dubai. And we've been in touch ever since, and it's been really fun. So, like, for example, I went to London a couple of times, and we would meet up, and this one time, for example, he gave me a tour of the Royal London Hospital, and while I was at the Royal London Hospital, we recorded a YouTube video about his company, Medical Realities, and some of the work that they do. And so this is really exciting. It was an unforgettable experience. And the fun part, by the way, was that after Dr. Shafi's warm welcome for me and my family, he invited us to have some of the best Indian food that I've ever had back in London. And so that was really exciting, and I'm very glad to have Dr. Shafi back on the show today. And so, hello, Dr. Shafi, how are you? Would you like to begin by introducing yourself?
Hi everybody, it's Shafi Ahmed. I'm a surgeon based in London, working at the Royal London Hospital. And it's been a great pleasure to meet Tanmay the last 2-3 years, where we share discussions around the future of innovation, technology, and where healthcare might propel us into the future. So I'm a bit of an enthusiast for digital innovation and healthcare, and I work with a number of companies and governments around the world, looking at how we translate some of this digital intervention into real practice to make real outcomes for patients.
Thank you very much, Dr. Shafi. Great to have you on the show. One note I do want to quickly say is that everybody watching the live stream right now, as always with Tech Life Skills, we're going to be answering your questions at the end. So whether you're watching on Periscope or Twitter, Facebook, or YouTube, feel free to put your questions in the comments or the live chat. And towards the end of today's episode, we will be answering those questions. And of course, a very sort of special emphasis on Dr. Halverstadt's question. Thank you very much for that once again. What will the face of medicine look like in 10 to 15 years given the emerging effects of COVID-19 and technology? Now, we'll get to that in just a moment. But first of all, Dr. Shafi, I want to start off by asking a more fundamental question. And I wanted to get your thoughts, since you're in this field of healthcare and you have firsthand experience with these sorts of things. What is sort of like the impact of COVID-19 that we don't usually see and that we don't usually talk about, right? So there's that sort of forward-facing impact that we all see, it's stressing out the healthcare system a lot. But what are the sorts of things that are going on behind the scenes that you don't usually see, things that the news doesn't cover in terms of the impact on the healthcare system?
So that's a really good question. And let me show you my inside views from the work that I do at the Royal London Hospital. And also, I was part of the team that built the Nightingale Hospital, the kind of field hospital at a major conference centre in the UK in over 3.5 weeks with the military support. So let me show you my thoughts on how we recreated a healthcare system that was fit for purpose. So the first thing, of course, is the hospital had to change fundamentally. So hospitals had to redistribute the workload accordingly to manage the pandemic. Because at the time we were thinking there might be up to 500,000 people affected very quickly. We don't have enough of them. So we had to redistribute, recreate intensive care, critical care beds. We had to change the way we were working. So the workforce was redistributed. Elective surgery got cancelled. We'll come on to that a bit later about the effect long term on cancellation of operations, etc. So all the pathways changed. The front phase of the hospital had to change. We had to have a dirty zone and clean zone across the hospitals. The emergency would come through. But of course, prior to that, there's a telephone service that was going to triage patients with a symptom checker, for example, that could be done through either AI or through a proper telephone conversation with a real person, for example. And once they're into hospital, the whole system was recreated to ensure safety for staff and also to ensure that we manage the patients well enough. So the entire infrastructure had to change, the workload changed, and the workforce was redistributed and retrained to manage some of the problems. So, for example, people who may never have seen a ventilator before will suddenly be retrained to manage a ventilator, for example. It was just the way we manage things. More importantly, is just to make sure that the workforce was um, really motivated. Obviously, it's desperate times. We saw a lot of death at the front line across the entire world, of course. How do you motivate? How do you keep them safe? How do you manage their risk? And how do you manage their illness? Because sometimes healthcare workers are unwell. So how do you make sure the workforce is sufficient to manage the workflow? So in fact, everything changed in terms of hospital. I'm pleased to say in the UK, the increased capacity with the lockdown measures and government measures, of course, was enough to manage that pandemic quite safely. So we learned a lot about epidemiology, around, of course, our numbers and how the infection risk was going to be increased, and how we use communication tools, triage, and also redistribution to manage that more effectively. So there was a lot of change. It was all about change management at Tanmay, which is a key parameter in making the healthcare system work, of course.
A lot of change. That's really interesting to hear. One thing you mentioned there that really sort of hits a note for me was around what you mentioned around using, like, for example, AI and chatbots for symptom checking, right? So that's one example of how not necessarily having, humans is scalable in that system. You've got to be able to use automated systems such that it's natural for people. They're not clicking buttons, but at the same time, they don't have to interact with a human, and therefore, using human power where we don't necessarily need it just for those conversations. That's really interesting to see. There's a lot of change happening. And in terms of the change, of course, every country, every region, every government is doing these things differently. Everyone's reacting to this crisis differently. And so, since you're working with so many new technologies and since you have this firsthand experience, do you believe there are some examples of like COVID-19 response or maybe some use cases that are really just exemplaries, things that you want to highlight, things that you think are really effective and just exceptional?
Yeah, sure. I think in the background and the context of this Tanmay, I'm not sure you've ever played or seen Final Fantasy, the kind of the game on the net, because I saw that the other day, and there was a picture and image that really came to mind. And there's a picture of the two of the, I guess, stars of Final Fantasy talking about time and the compression of time, which I think is a fantastic term. What we're seeing with the pandemic is a compression of time. So what we want to do over 2, 3, 5 years has now been compressed into 2 or 3 months. It's been a technological marvel, if you like. Yeah, it's transcended, pushed, accelerated this whole situation for us to make it better. So that's the context of what I'm talking about, which is a good thing for healthcare, of course. Otherwise, we would struggle with all the barriers that are innate in healthcare systems. So let's take a few examples. We're now moving patients onto remote monitoring. So patients conventionally with chronic diseases like diabetes or chronic obstructive airway disease and other kind of chronic diseases were seen regularly in clinics before. We've now moved on to telemedicine, remoteness, seeing people routinely through telemedicine platforms and monitoring the systems remotely, maybe using sensors and wearables, etc. So we see an entire shift of patients being managed in the community better. Telemedicine is amazing. What we've seen in the first 2 weeks of the pandemic was the utilization of telemedicine went up by about 2,000% in the first 2 weeks. And now it's still accelerating. There's so much capacity being built for telemedicine. So if you're talking 3 months ago, we'd be breaking bad news to cancer patients, for example, using a telephone or telemedicine, we'd think you're absolutely crazy. It just wasn't part of our conversation. It's human to human contact, interaction, and the empathy to handmade. So we've completely disrupted that model. It's actually, we can do this way, which is what I've been talking about for the last few years. How we're going to change that conversation between face-to-face contact to be more virtual, which is more cost-effective, and more flexible for people to be seen and reduce their time away from work and etc. So that's been 2 things I've seen that's really transformed the way we manage our patients.
Wow, 2,000% increase in telemedicine usage. That is exceptional. And it's interesting to see because a crisis like this one has sort of forced us to adapt and forced us to evolve. And I was actually covering this in the last episode of Tech Life Skills with Tanmay around education. In a way, it's sort of forcing us to innovate. right? It is forcing us to come up with new solutions to problems that we may have already been facing, but just kind of dealing with. And now we're forcing ourselves to solve those problems to make sure healthcare is as effective as it can be, even in a time like this one for everybody. And that actually brings me to my next question, and this is sort of more around the world of technology and how it relates to healthcare. And that is that we're generating a lot of data. Right? Data is the one thing that we are generating way too much of. And each individual human is generating terabytes of data in their lifetime that can be relevant, that can be useful in providing them a healthier lifestyle if it's analyzed the right way. Now, the problem is that there is simply too much of this data for humans to comprehend manually. An analogy that I love to give is that if you were to take every single medical image taken in the US just in 2015, so just one country, 1 year, and if you were to print each individual medical image on just an individual piece of paper, and if you were to stack up all of those papers, you would have a stack of papers taller than 5.5 CN towers. That's a lot of data. And not only do we have a lot of data, we have a shortage of the humans that we use to actually analyze that data. I mean, even before this entire coronavirus crisis, the World Health Organization estimated that by 2030, we would have a shortage of around 12.9 million healthcare workers worldwide. So we need more people, right? We need more data analysis skills. We need more experts, is what I'm saying. But at the same time, we have a lot of data, and we somehow have to make better use of it. And so immediately the thing that comes to my mind is AI machine learning. These technologies are going to be immediately impactful in the field of healthcare, which is why I'm so passionate about applying these technologies in this field. So in your opinion, since you've been working with these technologies and since you've been working within the field of healthcare, across the whole spectrum, what are some examples of how machine learning is going to help us in the field of healthcare? And I mean all the way from, the end users and the actual patients to the medical practitioners to even the factories, that are producing the vaccines, all these. How will machine learning help from end to end within the field of healthcare?
Thanks. It's a really good question, and it's a really big question to answer. I'll try to do my best to summarize it in the shortest time as possible.
Yes.
I think the best way to imagine it, let's go through a pathway, okay? And let's imagine a patient who has symptoms. Let's take the user experience and the end user, the patient, if you like. So imagine someone has a cough in terms of COVID, has shortness of breath, and maybe coughing up some blood, which is a serious sign, for example, and wants to get advice. So the first thing in the future where AI and machine learning will add value is this. Conventionally, they'd go and see a doctor, make an appointment to go and see them. Then, of course, they'll be sent to some tests. Then the test results will come back to the doctor, who then organise further tests, maybe further consultation with a specialist, who then do further tests and maybe more interventions, maybe an operation in the future. And then, of course, it's the outcome. So that's kind of conventional we expect. Let's see how that will translate now into AI. So the patient, first of all, has symptoms. Could first go to a symptom checker, an AI chatbot, for example, right? Say, okay, here's my symptoms. What's the risk of me having cancer, for example, compared to something that's more benign? That will give you an answer straight away on your smartphone saying, we recommend you go and see this doctor who's available now to have this test done. Okay, your X-ray, for example, and CT scan can be booked immediately on that. So you literally turn up without seeing a doctor because you've done symptom checker, which is highly reliable. You have your scan. So this could be a CT scan, for example. Now, CT scan will be done and immediately, using deep machine learning of those images, you get a flag on your phone saying, this is the result, please go and see this person immediately. No waiting for dates, appointments, not worrying about what the result might be. Actually, it's there and then immediately, in a millisecond, because it's analyzed straight away, there's an abnormality. Okay, let's go and see a doctor. You go and see somebody now face-to-face, or telemedicine now it could be. So you're seeing face-to-face, and if you look at some of the interfaces now in telemedicine, they'll be analyzing your voice, your face, seeing how you're predicting things. Is voice tech enabled so that there'll be speech to text dictation automatically on the frame, reducing the time required for that doctor to do handwriting, enter notes in the electronic health record. Then you might need a test, of course, a further evaluation of a lesion that might be in the lung. You could go then and book yourself to have a robotic guided imaging. So they will literally put the images in that you had ready, guide it through deep machine learning so that it automatically goes and finds the right area to biopsy and sends that to histology, pathology analysis. That pathology analysis could be done by AI. So pictures, images saying, it's the distribution of these cells, we think you've got this. Please go and have your treatment. So then you say, okay, you go back and say, this may require an operation. What about the operation being done remotely using 5G technology by a robot who can look at computer vision during the operation about where things are? Okay, it could be a surgeon who's human and be predicting what's going on in the operating field, indicating areas of danger, telling you about what next steps are, or it can be done remotely using connectivity. So that whole pathway could be completely disrupted using deep machine learning. And that's what I've been talking about for a long time. I don't think we're too far off from seeing every stage of your cycle being much faster, more accurate, and hopefully driven by your own data.
Wow, that is exceptional stuff that you just mentioned there. And specifically what I feel like you said, and this is really exciting to me, is that with the power of AI and machine learning, what we're not doing is we're not replacing the human experts, but rather what we're doing is we're making it so things happen faster and more accurately by filtering down that data and showing human experts what they need to look at, not everything that's available to them. And by doing that, we can make it so that the humans themselves are able to deal with more patients in a more efficient way, and yet use that power of machine learning and deep learning, learning from literally everybody in the world, and then apply that to new patients. So I feel like that's incredible. And in your opinion, do you sort of confer there? Do you believe that this AI machine learning technology is going to augment these human experts in the future?
Yeah, I think the word to use, Tanmay, is augment. The public are very scared when you say you're going to replace doctors. It's a scary terminology, and we're not ready for that conversation as a society. It's not the one that should be spoken about anyway. So my view is it's about augmenting our practices. But what I mean by that is that, look, we have a lot of wastage in the work that we do. And you've got to wonder, what is that, say, doctors, for example, are supposed to be doing? So let's take an example of this. Our junior doctors in the hospital, there was a study done, I think, about 18 months ago. They showed that 70% of their time was spent just doing paperwork or putting records into electronic health records. So have you spent your entire life training and spend almost of money and resource trying to get to become a doctor and not spend that time actually being a doctor? So what this allows us to do, it frees time. It makes things, as you said, much faster, more agile. And maybe there's the whole concept of technology and all this AI, for example, might make us more human because we have more time to do things that we want to do. So the thing about replacing doctors not relevant, it's actually giving us time to be more human to our patients, because we won't be worried about all the automated things that can be done by other technologies. So that's kind of my view of it. And the word is augmenting, supporting, assisting, making life easier. And if you ask the patient, would you prefer a doctor who didn't have to do that work unnecessarily, but was actually able to practice clinical medicine? Of course. It kind of makes sense, right?
That makes a lot of sense. Thank you for sharing that. I love what you mentioned. That's a quote right there, is that with artificial intelligence technology, we are becoming more human because all of those tasks that don't make us human, the ones that don't require that creativity or imagination or empathy with other humans, those things are now offloaded to technology, to computers, so we can focus on what we need to focus on. And this is the case for, healthcare experts, of course. And that makes them more efficient, but that doesn't really change the fact that we still have a shortage of experts in the field. We definitely need more and more people to be working because we want to be able to scale up healthcare in a way that we can provide quality healthcare in every area across the world, right? Because we want to make sure that everybody has access to that healthcare. And the thing is, training experts in that case becomes very important. Being able to train experts in a way that, again, we have high quality. Unlike other fields within healthcare, we have no scope for decreasing quality. In other fields, if you cut corners here and there, it doesn't really matter. It's not life and death. Here it literally is. And so it needs to be high quality in terms of training, and people need to be trained well, but at the same time, it needs to be as fast as possible so we can pump out as many of them as possible as well. So how are you using the world of technology to help train these sorts of next generation healthcare workers, next generation experts? I know specifically you do work with surgery and surgeons with your company Medical Realities. I would love to know more about that.
Sure, I'd have to share. And it was great to hear from Dr. Halstead earlier, who's been a pioneer in education for his entire lifetime in Oklahoma. So it's great to hear his thoughts earlier about traditional methods of teaching. So look, we need to move on. The way we've trained surgeons in the past has been rather archaic and probably not good enough. We've now got an educated workforce and students who are now digital savvy. It's about using technology, it's about using social media, it's about having information to hand immediately, not relying on traditional methods of learning. The other thing about surgery in the context of this is that if you go to an operating theatre, operating room, you might put it in America, it's that you have a number of students in the operating room all together, maybe 4, 5, 6, 7, however many, not really engaged because obviously we're busy with the operation as surgeons. It's hard to trap everybody together, and hardly anyone gets to look into what's going on. Yeah, it's kind of this old-fashioned way of teaching, and I call it's a way of teaching by osmosis and diffusion. It's kind of being in that presence of the operating room that you kind of assimilate some information, which is not true. It's not active, it's not interactive at all. So that's going to change. So what we've done in the last few years, I've experimented with different ideas, both in augmented reality and virtual reality. Augmented reality is where you have a overlay information in front of you on the screen you can play around with, like a jet fighter pilot. And virtual reality is where you're immersed immediately into a virtual world, and I'm sure you've seen the headsets, so the audience has played around with it. So we've experimented with Google Glass, with different technologies to live stream operations globally. Back in 2014, I used Google Glass to transmit an operation live, using the specs, which I could just literally voice activate, send my point of view learning to thousands of people across the world. And that was operation, I think I taught about 14,000 people in 118 countries, simply because you connect on the smartphone, watch what I was doing, interact with me by putting text messages onto the smart glass. Then of course VR is different. It's about connecting people in virtual reality, bringing them from remote areas into the operating room. Yeah, this democratizes education. Imagine someone who doesn't have access to great education, but would like that, which is their human right, of course. They could literally put a headset on, suddenly be live in the operating theatre with you, watching what's going on, interacting with you. So I did the world's first VR surgery back in 2016, and that was to 55,000 people across the world. We then thought, okay, what about social media? Social media has a huge impact. So I've done operations in Facebook Live when it first came out, on Twitter using tweets. I did the first operation using tweets live from operating theatre in London. And then we did Snapchat. Snapchat spectacles came out. I did a small clips, 10-second clips on my Snapchat spectacles. I pushed out to my audience of many thousands of students. Wow. And that went viral. That was watched by over 2.5 million people. And of course, next month or so, had a huge reach because we understand the mechanism of knowledge transfer. It's different. It's no longer books on online platforms. It's immersive. It's real. It's immediate. It's using social media. It's using all of these digital technology that are free of point of access to help democratize education globally. So with Medical Realities, the company that I run, which is the AR/VR company, we've created learning tools in both augmented reality and virtual reality. If you go to our website, medicalrealities.com, you get to download some software onto your Oculus Go or your HTC Vive or your Android or your Apple iPhone, and then interact with it, learning from examination techniques, surgical operations, simulation. Suddenly, you can learn at home. What we're seeing now, so this was, 3, 4, 5 years ago, we're ahead of our curve. What's happened now, Tanmay, which is fantastic, is that this pandemic lockdown, everyone's after virtual training. So when we need virtual trainings, now the world is ready for virtual training. Now I think it'll expand rapidly. The people looking for different ways of learning. So all the work that I've been doing for 3 or 4 years has now become more obvious and more relevant. In fact, a while ago, I was on a call with Wired, and they were saying, Shafi, now that you've predicted the future, what are you going to do next? Because we've been talking about this for a few years. Now I think the problem is implementing those changes. We've got the tech, people are ready now with their mindsets, they can enable different healthcare system. Now saying, okay, how do we translate that pace? How do we make it stick and have that new normal going forward? So education is changing entirely at the moment.
Wow. So it's really great to see that you've always been ahead of the curve in that sense. Like you've been working with this sort of virtual training for the field of healthcare even before all of this coronavirus crisis has sort of forced us into this innovation. Again, exactly what I was talking about in the beginning. Coronavirus has sort of forced us to innovate even if we don't really want to, and we're starting to see the advantages of that innovation now. So actually, we were talking about this last week again on that on the education panel I was talking about. All education must be done virtually now. If you don't have technology, you're not going to be schooled. You're not going to be learning. So you must have some form of technology to learn. And when it comes to healthcare, next gen technology, like as you mentioned, virtual reality, augmented reality, is how we're going to be training the next generation of surgeons. I really love that. And I mean, we've talked about AR, we've talked about VR, and these are technologies that I'm very passionate about, but I haven't done a lot of technical or development work with just yet. One of the reasons for that is because VR, AR, that's more like front end stuff, whereas I'm more in like back end and logic development, that kind of thing. But regardless of that, I'm passionate about these technologies, and I have a question, just like so many other people. VR and AR serve different purposes, right? So there's virtual reality, which is you want to immerse yourself into this virtual environment. There's augmented reality, which is I want to add information to the world around us. And so, could you please tell us a little bit more about maybe within the field of healthcare, or even more generically, about the use cases for VR or for AR within healthcare? You know, traditionally when people see AR, or VR, they think, oh, it would be good for entertainment, maybe some kinds of education, but not much more. And when they see AR, they see a lot more scope. So could you maybe expand upon the use cases for both in healthcare?
Of course, and remember the not two extremes. They're just kind of, it's a continuum, if you like.
Yes.
AR at one end, VR at the other. And in fact, what they term now is extended reality. So AR at one end, VR at one end. In the middle, you've got mixed reality. All three combined are called extended reality. Exercise new terminology for your audience specifically. So look, let's take AR for example, and let's take surgery as a discipline about the use cases and potential use cases. So imagine you're in the operating theatre, and say someone's had a fractured bone, say on the leg, for example. And so what you could do with augmented reality is put images into your viewer, into your glass, which could be a head device. You can look at the body in real time, and the image would be overlaid with the bones, where they're fractured, and how you have to manipulate them, for example, to do the operation. Or they can visualize a tumor as you're doing an operation in live onto your liver or somewhere else, say this is the blood supply and this is how you should negotiate. So pre-operatively and per-operative during the operation, you could plan the operation around that, okay? That's the kind of one of the values for augmented reality. We may think that's far-fetched, but last year, 2019, 2 companies got FDA approval for use of these technologies in the operating theatre. So we're not that far away from the future at all. Virtual reality is slightly different. Obviously, there's no viewing, you can't see the outside world. So what does it allow? It allows simulation training. And the number of companies out there now that will teach you how to train to do, say, an operation. You can put the headset on. And the beauty of being in the virtual world, it replicates real life because you've got 360 view around you. You can create environments that will stress you, to make you anxious, getting used to the operating room, for example, right? There could be interaction going on. And then you'll be able to do an operation, as you see, in 3D. Because these virtual reality platforms now have 6 degrees of freedom, which means you can move and walk around that room as you would do normally, right? Which you can't do in AR so easily. So you can pick up all the devices, do the operation, practice, and that will shorten the training required until you get to the OR for life, but for real, for example. So we're seeing that real-life simulation being trained. We're also seeing these 360 videos will allow you to do examinations, and we've created what's called objective structured clinical examinations, which are the kind of go-to exams that we have in medical schools, and recreated that in a 360 environment. So you get the experience that you've been trained and you're examined, and actually you nowhere near being, you don't have to have a patient there, you don't have to have, for example, a room available to you, you can do that virtual training. So we're seeing the whole of surgery move into these areas rapidly with use cases that are better. And the thing about VR in terms of learning, there was a study done by the Mazer report a while ago, and it's been repeated by a number of other cases, that your knowledge, your retention of the things you've learned is much higher The amazing report felt there could be up to 80% more retention of facts compared to online education platforms. That's
Wow.
compelling because it's that immersive nature that's hard to define, for example. Yeah. And also we're seeing in therapy, we're seeing people being treated with VR therapy for pain, for example, people in labor, women who are having babies, are using VR therapy to avoid the necessity of painkillers, opioids, or even epidural catheters. We're seeing people treated for cognitive behavior disorders, for stress disorders in the military, for example. So we're seeing a lot of use cases now that will allow us to actually prescribe VR therapy, which has the effect of treating people, no side effects of drugs, etc. So we're seeing the whole thing now change, where this could be a new modality for both education and for therapy.
That is exceptional. I mean, the fact that they have FDA approval and the fact that we have this like 80% greater retention of knowledge versus online learning, this proves that this technology is going in the right direction, right? This proves that this is something that's not, far off in the future. Eventually we'll have virtual reality training. This is something we're working on today and that you're making possible. That's great to hear. Now, I want to circle back a little bit to AI technology. And I mean, we touched upon the fact that artificial intelligence is meant to augment humans. It's meant to make us more human. But the way that I like to look at it is, in a way, I believe that eventually in the far future, when we have much more advanced AI, not the kind that lots of people think of when you say advanced AI, but just generally more complex machine learning that's capable of achieving more, I feel like we're kind of going to redefine what it means to have a job. We're going to redefine what it means to work in the sense that any job will require you to be human. Today, we have jobs that don't necessarily require that. We have jobs that don't require creativity or imagination or empathy. But in the future, the thing is, because of the fact that automation via artificial intelligence is going to become so complex, we're going to need to have people working in jobs that requires those unique human skills. And I believe it's a spectrum of these jobs, from the ones that require the least human skills, will be most automated, to the ones that cannot be automated at all. I would say none would really fall in that bracket. There would be at least some kind of automation, but still, it's a spectrum, right? There's a ratio for each job role of the level of humanness versus the level of computerness that's required. So, for example, you mentioned with some medical practitioners, 70% of their time is used doing paperwork. I would believe that it's not like we're going to strip away 70% of their job role, but rather that 70% is going to be filled with more useful tasks. So, do you have some sort of analogies that you could give us of different job roles within the field of healthcare, and maybe give us some ideas of the ratios of automation to humanness and like non-automation for those job roles?
Yeah, it's an interesting question. I absolutely think you're right. Your time will be spent more effectively in the future because of the fact that AI will take away some of the jobs that are less desirable. So, for example, putting data in. Yeah, data is the key. You mentioned earlier, right? So, how would you enter data? Why would you physically enter data? It's such hard work physically, right? It should be done automatically, whether it's through the electronic health record, whether it's use voice-enabled learnings that learns and puts data in automatically, or you can decipher simple text from beforehand and just understand the information within. So I think, so let's take an example for primary care. Primary care is going to be revolutionized. What we've seen in primary care has been, obviously the front face of the healthcare systems. And they see the patients first of all. So they were the first really to drive hard triage. And we're calling it total triage now, okay? So the pandemic, there's hardly any face-to-face contact in primary care, okay? They've transitioned so quickly. So now their work is very much in telemedicine. The data stuff they're doing in the back end will be AI automated to help support them through a platform that connects the telemedicine platform, that connects the electronic health record, they can seamless transition of that data so they can actually spend more time and see more patients in the same time than otherwise. At the moment in the UK, for example, you're given 10 minutes for a consultation in primary care. That's what the healthcare awards you. Make an appointment, you get 10 minutes. Now, 10 minutes, imagine this. How long does it take to actually find out what's going on? And then writing it, sending a prescription, all in 10 minutes. It's really hard work.
Mm-hmm.
What about in that 10 minutes, if you just manage to speak to the patient, for example, and this will all be recorded as you're doing it, as medical record. You can take your voice and what you're doing and automatically issue the prescription automatically. also put data into the right files so that data can be used and captured for epidemiology, for managing patients better and seeing the trends in your own healthcare system. That's the beauty where I think AI will help in managing patients to more effectively and allowing more time for this human interaction. So I think primary care is ripe for disruption at the moment. And the other, of course, is radiology. We mention all the time. Images, pictures are the ones most suitable for AI. And so what you see now is radiologists who report X-rays and images can now hopefully only concentrate on the difficult cases, yeah, where most of them are automated and 90% can be just quickly yes or no what's going on. But 10% that requires more conversation with the clinician. It requires more interrogation about what it is. We're not sure what's the history, what's the story, how do we get to the bottom of this? Is X-ray showing something? Those we've spent more time looking at those, which is the interesting part of our job. That's what we want to do. We don't want to report a normal X-ray after normal X-ray after normal X-ray. What a waste of everyone's time, right? That makes no sense to me. So that's the kind of thing I think will be changed.
Fascinating to hear. And actually, what you mentioned there around vision specifically, I want to elaborate upon that for a moment. And right after that, I do want to take a quick break before we continue answering questions, and I want to do something fun with you. So my question for you is: you mentioned that visual data is great for AI, and it is. A lot of people have focused very specifically on really advancing the state of visual understanding within AI. But there's another sort of field that I'm most interested in personally, and that is the field of linguistics, natural language understanding, using the power of machine learning to understand, language. That is what just really excites me. And what do you think the scope is of that natural language understanding specifically within the field of healthcare? Do you think that's going to have a large impact? If so, in what areas?
Yeah, absolutely. Great question. Absolutely. I've been saying for a while that if I was a good businessman, I'd be investing in voice tech. No question. I think that is the future, Tanmay, right?
Yeah.
So because you think about Alexa, think about Google Home, these are powerful devices, right? So Alexa, and in fact, Alexa's just got off as I said her name in background in my she was quite amazing. So I'm saying they're going to be really useful because that's your first point of contact at home, being remote, getting advice from these voice activated systems. Imagine that as your first point of contact, understand your language, who you are. Now we've seen some companies, for example, one is called Beyond Verbal, who are now looking at, you can talk to your smartphone every day for about a minute or 2 minutes. It picks up your voice and can predict the onset of cardiac problems 2 weeks before it arises, if you have cardiac problems before, right? So that will reduce the requirement for admission, manage your conditions, and hopefully prevent unnecessary death and complications. So imagine that with mental health, for example. You can talk to you every day, picks up your problems, manages it, etc. Suddenly, it can be something to help you with CBT therapy, with mental health awareness, which would be amazing because the pandemic will create a lot of mental health problems. We know that, right? Because of lockdown, because of people's anxiety and stress and the death that people have been exposed to. So I think voice tech and these kind of platforms are absolutely fundamental part of our ecosystem. And I'm really excited by seeing what that future promises as it becomes more and more sophisticated, as it learns more and more ways of measuring our outputs and looking at our entire conversation. Remember, we're not just about voice, remember. It's a whole ecosystem. It's our social media. It's our habits of how we interact with social media, how we interact with community people, right? It's our data on healthcare. It's our voice. All of that in the future can be captured to give you really personalized and precise medical therapy. Yeah, it may not be medical therapy, it may be other therapy. For example, social prescribing or something else to support your healthcare, maintain your wellness and well-being, rather than giving you a drug at the end, which may not be necessary. So I think we'll have this whole different approach of holistic medicine based on these kind of data points.
Wow, natural language, really excites me because of the fact that subconsciously the way that language is represented in our minds kind of forces us to encode more information than just what we want to get across in that language. And what you mentioned around being able to predict, for example, cardiac problems and of course mental health, these are all perfect examples of that sort of knowledge being transferred through language. It's pretty incredible stuff. Who knows, maybe we'll have a separate tech life skills episode on language one day. That would be really fun. Now, first of all, though, before we get into the live Q&A, I do want to take a quick break. I really like your shirt, Dr. Shafi. I know you gifted me one when I was in London. I love it. You probably saw that in the promo video for Tech Life Skills. Would you like to show us what's so special about that shirt?
Oh, so I'm glad you still got yours, and I'm glad it's yours. I'm just getting the app out 1 second, and I'll see if I can play around. We tried it earlier.
Sure.
This is a reality shirt. I'm just going to load up the software, and what it allows us to do, what I've got here in front of me, is a shirt with a picture of an abdomen. So once it all loads up, I'll see if it works. 1 second. So you can see that. So my phone is just logging onto the app, which will work on now. Okay, so hopefully this will work now. So that's my shirt. So if I use the camera and look at the shirt from a distance, did you see that?
Wow.
You can see the innards. And also, if I go close, if I angle it down slightly, you'll be able to see my gut all moving, contracting. You see that moving?
That is amazing. Yep, I can see it.
There's a t-shirt. As you come in, it triggers the augmented reality platform.
Very nice. So
So,
augmented reality.
It is, yeah, indeed. Yeah, I think this is the future of teaching and training. Now, medical students in the future would be so, I think they'd have a completely different experience in learning and education with all these technologies. And it's so exciting. I wish I was a medical student today, Tanmay, rather
Yes.
than 7 years ago, right? Because things have changed so measurably.
All right, sorry for those technical difficulties. We are back on YouTube. We should have been live on Facebook and Periscope this whole time, but we should be back. And Dr. Shafi, please continue. I would love to hear your thoughts.
Yeah, so talk about how technology might democratize healthcare around the world. So talk about education and how that's going to be more virtual. Therefore, you can teach en masse many people around the world, upscaling and sharing knowledge on a global level. So there's no question that tech is enabling people to get access to education globally. Healthcare, of course, much the same thing. All you need now for healthcare is a smartphone and probably a 3G connection to access healthcare. Okay? Talk about AI, chatbots, etc., which is universal, will be soon. Access information and real-time monitoring. Look at the telemedicine platforms now and they have low bandwidth. They can give you immediate access to a doctor or a nurse or a healthcare worker. So actually, that's made it easier in relative terms compared to what we like before. People in remote areas, for example, can't access healthcare. So actually, this has made it much easier. So I think tech has the ability to actually allow people better access, make healthcare more accessible and equitable. Ultimately, what we're after is affordable healthcare, which is what we're driving to. I'm just going to put my charger into my computer. Sorry, it's just...
No worries at all. In the meanwhile, thank you for answering that question. And I sort of want to, in a similar vein, there's another question, and that is a question from, let's see over, a question from Lavi Kolchinsky. Sorry if I'm not pronouncing that right, but he says, how good do you think VR simulations are? And I would assume in the sense of, how good are those simulations for actually training healthcare professionals?
So that's a really good question. Thank you for that, Lavi. So look, there's a roadmap. If you look about 4 or 5 years ago, there's two bits of VR. One is actual real life environments recorded in 360. That's your live environment, of course, right? That's realistic. And the other end is the CG animation, yeah, that we create. It's something that has been partly cartoonish, not been good enough, right? Because it doesn't look as real, but still the training within that is very real. You can create interaction and validate with what you do. So they're still very valid. What we're looking in the future is photoreal images. Think Pixar. Think really high quality images going forward, but suddenly that reality is recreated by images. So VR is heading that direction. The headsets are more powerful. They are, compared to where they were before, they're more mobile. They're not connected and tethered to a computer. So we're seeing all 6 degrees of freedom movement. So all these things with interaction with the hand controllers, with tracking, etc. It's how experience we're looking for now. It's much better than before. So one is the images of photoreal images, which we're heading towards. One is the experience of the interactive elements of the environment, walking around the hand controllers. All of these are being really fast-tracked now. In the last 5 years, we've come a long way. And if you look at the latest headsets, They are really brilliant. And I think the game changer was last year with the Oculus Quest. When that came out, I thought suddenly we have the headset we need that we're all worrying about that was going to arrive. It arrived quickly, and now it's quite compelling. And that will carry on, of course, getting better and better in the next 2 or 3 years. So I like the question, but I'd say not all of it is, you don't have to be completely photoreal at the moment. You still get good learning and simulation despite not getting to that point with still pretty good images and interactive and validated methods of learning.
Yeah, and I feel like a reason for that is also that humans, unlike machines, have that sort of general purpose reasoning. And when you're training a machine on, like, for example, simulated data for self-driving cars, for example, sometimes it can be a little difficult for the machine to adapt from simulation to real world just because there's so many differences between simulation versus real world. But when it comes to us as humans, even if we're trained, again, as you mentioned, not in necessarily a photorealistic virtual environment, we're still able to understand those concepts and adapt them to work in the real world. Right? We can reason like that, so that's pretty incredible. Now we do have another really interesting question from Dr. Nikhil Damija from India. He says, with the current technology and software with like databases and medical advancement, can we build software that stores all your medical, dental, lab reports, etc. into a universal, unified portal? So if a patient travels internationally and seeks medical or dental attention there, the treating doctor can go through the patient's near or far medical history through this unified portal. I feel like that's a really, really interesting sort of example. He's from India, so he's taking the example of an Aadhaar card, for example. And so, what are your thoughts on that, Dr. Shafi? Is that practical? I feel like that would be useful. What do you think?
That's a great question, and something that we should aspire to, no question. So look, the problem we have is this, and the word is interoperability, and you know that, Tanmay, right? So we've got legacy systems, we've got a lot of electronic health records out there, and the two main players at the moment are Cerner and Epic, which most countries use, and others around that, of course. So the problem is that these systems essentially don't really connect with everything properly. It's not like pick up a Google phone and then connect into the ecosystem. They're not that sophisticated. So everyone has to build on what's existed through pathology, for example, or electronic health record data, or radiology data with PACS, and still build around this to make it all connect. So they are getting there where actually each ecosystem is now being more connected. We know that some of these companies now have all the APIs created across all the necessary data points to connect it seamlessly and much faster. That's happening as we speak. In terms of universal healthcare, so I work for the Abu Dhabi government, for example, as an advisor, and they have created their own healthcare system on 50 hospitals and health centers, a central healthcare information exchange. Now it's all connected. Suddenly, the whole system's connected. So you can do it in one country if the ambition is there to invest and make sure that data points are great. In Scandinavia, they've been doing data for a long time. They do connect pretty well. In terms of international data points, we'd love to get to that stage where you can literally, as you say, go from India to the US and your data will be upstream, etc. The problems you have are regulations. Okay, each country has different regulations to be able to do that, barriers. Each state in America has barriers and federal changes, right, about what data is collected. So the world has to think about this globally, and the pandemic, I think, has been pushing us now to think about global solutions. And I hope that's a legacy from the pandemic. So actually, how do we connect the world? How do we create a better healthcare system that does connect and give people access to better healthcare? So that's the aspiration at the moment. I think one of the things we need to do almost is go back to square one and be really disruptive. Let's create a unified healthcare system, a health record that everyone is going to accept around the world. Take time building it. Suddenly it becomes a language for everybody. A central repository, you create it, everyone builds. And that would be great if we could do it. The problem we have is governments, regulation, different policies, etc. I think that would be hard to overcome. There's nothing to support you having your own healthcare system drive your portal to give it information as a database which you can carry, maybe through a smart card, to another part of the world. Those are the ambitions that we have and aspirations. And I think this global pandemic may help us down that path, but that's a long journey.
That's really what I believe. What I took away from what you just mentioned is that we want to aspire to have this sort of global system where everybody's speaking each other's language and we have this sort of universal electronic health record system. And one of the things that I'm sort of relating this to is a language developed by L.L. Zamenhof. Again, probably not pronouncing that right, but back in 1887, he invented the language Esperanto, which is the world's the most popular constructed language, with the idea of, it's a language that was built. It has no heritage of any sort. It doesn't inherit from any other languages. It's not, something that's tied to a certain geopolitical region. It's just completely generic, neutral, and super easy to learn. Just takes 150 hours to learn. So imagine if we have that, but for health records, right? And something that we can all agree on. That would be pretty exceptional. That is definitely the future. Now, we do have a question from Tina. And Tina says, how much of AI, AR, and VR technology is currently being used in the medical field? And how expensive are these to use? How difficult are they to use also by the medical professionals? So how much of it is being used? How difficult are they to use, and how expensive are they?
It's a really good question. So they're not used as much, obviously. Because with medicine, of course, it's hard to translate a lot of technology quickly across the healthcare system. But AI itself is being used, I guess, in some centers, mainly for images. But these are really isolated, small areas. Hospitals are innovative, that are doing pilot studies or just pushing things this year. So I think 2020 is the year that we'll see AI deliver more of its promises. It was hype before, very much hype orientated. Now we're seeing real life, real time scenarios where it's effective. So we know, for example, there's a company called Zebra AI, for example, produced an algorithm for chest x-rays, and they were charging $1 a scan. That was their basic go-to business model, which is not too expensive, if you think about it. If the AI is doing a scan at $1, that's not too expensive. Yeah, it's actually quite cost effective compared to paying somebody else to do those same images for you. And that cost will come down, obviously, as time goes on. AR and VR is very much new, and we're still, the virtual reality we've seen now in simulation training, in some special like orthopedics have come in with validation across parts of America and the UK and Europe. So we're seeing now small implementation in one specialty. That's kind of where we are with VR. We haven't seen acceptance widely. Undergraduate and sort of medical students are just engaging at the moment, very much early in terms of VR. AR, as I said before, has had its FDA approval, but again, not really being used much. Again, it's pilots, small areas, etc. So what we need to do in 2020 is change that from being pilots, small centers, to becoming more mainstream and kind of available. The price point is an interesting one. We have to almost really look at the whole modeling of finance in healthcare. And of course, the driver is always going to be financial. Do you get paid? Who's the payer paying for VR therapy or VR training, for example? How do you create a resource issue that actually becomes cost effective? So as technology comes in, we have to remodel the way we finance healthcare. That includes insurance companies, the government payers, to figure out where does it stand in the healthcare system? Where do we take money away from if there's a finite amount of resources? Mm-hmm. How do we portion up to other parts that are coming in? And that's a conversation that we've been having, of course, with various government support. When the FDA in America now understand that, they're fast-tracking innovation. I was with them a few years ago, advising them about innovation, Tanmay, and now they're fast-tracking innovation going forward and really changing the way the payer may pay for that. And I've worked with insurance companies in America who are now looking at different models of healthcare. If we can avoid hospital admissions, if we can put care in the community, then it becomes cost-effective in terms of offering repayments for those kind of treatments or education platforms.
Interesting. So it's something that we're still working on scaling up. It's something that we're still sort of working on getting out of pilots and into the mainstream, but the conversations are happening. People are understanding that this innovation is important. That's great to hear. Now, another question that I want to ask you, and I've purposely waited till now so we can cover a bit more sort of supporting content. And now I want to ask you the question from Dr. H. And Dr. H asks, and actually quite a few people have asked on the live stream as well, what will the face of medicine look like in the next 10 to 15 years given the emerging effects of COVID-19 as well as this next generation technology that we've been talking about? So we've talked about VR, AR, AI for training. Basically, what does the future of healthcare look like from that sort of face perspective, from that forward-facing perspective? What does it look like for the end user?
That's a really good question. So let's talk about that future. Let's talk about 2030. I think Dr. H was mentioned that as a kind of 10-year cycle where we're going to be. So there's two areas really. The first one is the patient experience, how that's going to change. And fundamentally, that's changed already in the pandemic. We talked about telemedicine, less face-to-face. I know, I've been working on holograms and avatars as well, doing virtual consults using my hologram and avatars. So imagine by 2030, where you can actually appear anywhere in the world, consulting, having access to records in augmented reality space, sharing data points with people, etc. The patient interface will be now either AI, a chatbot, as I explained earlier, a hologram avatar, or face-to-face telemedicine. That's going to go to point of contact. So that's the initial part. What about managing the problems? Of course, it's going to be about managing some chronic diseases, but in a different way, having remote monitoring, sensors, wearables, things that are getting data out constantly. Will be not 5G connectivity, maybe 6G connectivity, where things be latency being so low and fast speed that suddenly the data is there available all the time. It'll be data driven, of course. It'll be around particular patient data, whether it's genomics, whether it's wearable sensors, whether it's all the data we described before, to create a bespoke treatment plan for that particular patient. So they'll be having a much better personal experience with their data. And of course, then we look at the kind of care going to the community to manage well-being. So we're going to manage people's well-being, i.e. holistic medicine, preventing illness, trying to prevent as much problems going to the hospital as possible, making hospitals smaller, putting care into the community, expanding social services. So actually seeing a different way of managing the pathway of a patient care. That's an experience. From our end, we have to redistribute that whole resource around how do we make that healthcare more affordable for us. The GDP is going up year on year on healthcare. Population is expanding. We can't afford healthcare as is at the moment. Well, we change it, redistribute it, refinance it. So what I see, as you said before earlier, we're going to be healthcare workers short in the future by about 14.5 million by 2030. We have people wanting to do different jobs. This way AI and that kind of things, as I said before, we redesign the workforce so that we are more nimble, more flexible, and use these technologies to enable a better healthcare system. The next thing we're going to see is what I've seen over the pandemic is the convergence of technologies, also the convergence of private and public partnerships. Yeah, and so how private providers come in, whether it's the tech companies like Google and others, that will help support and help our healthcare system in the future. It could be any companies that will have an easier access, less barriers to adoption, different regulation, etc., where they can actually bring better things in. So ultimately what we're looking for is this whole concept of changing the experience, making it faster and more affordable, using tech as the interface, as the enabler to encourage that healthcare system to develop where it should be over the next 10 years or so.
Interesting to hear. I mean, specifically what you said about bringing sort of private and public together, that makes a lot of sense to me, and I feel like a good analogy would be the space industry, right? So like just yesterday what SpaceX and NASA did together, right? Perfect example. NASA, I mean, eventually they would have done it on their own, but it would have taken a lot longer and they wouldn't have innovated as much to get here. Whereas when you have private sort of coming in, then you have that fuel for innovation that you can't really, always get, at least reliably, with public. So that's really good to see that collaboration coming together. Now, you have shared quite a bit about your company, Medical Realities. Would you also like to share where people can go online to find out more about your work and where it's going in the future?
So of course, yeah, so you can go to our website, www.medicalreality.com. You can download our software on iOS, Android, HTC Vive and Oculus, and play around with our platforms for surgical training, some simulation also for OSCE training and examination for our doctors and medical students. So that's available today, and please go and try it out and give us your feedback. Love to hear it. We're moving on from that. We're developing a whole lot of different platforms, new technologies going forward the next few months, so watch the space. We also released a platform about the last 6 weeks called covid.medicalabs.com. So we realized there was a resource issue of credible information out there around COVID-19. So we brought the global community together to create a resource so you can access all the information around COVID for healthcare workers. If you're a nurse, your doctor, dentist, doesn't matter. The information is all there. You can learn from videos, etc. we've created. Also, we have a live grand round almost every evening at 6 o'clock UK time with experts in different disciplines that we push out onto our platform and do live through Facebook and also through Zoom. So do join us, go to our website, play around with it, and we'd love to hear your feedback. This is obviously the right time to talk about virtual training. We'd love to see what you're thinking and how we can create the tools required that you are going to find useful in the future.
So once this live stream is complete, I'm going to go ahead and take those main links that you mentioned, put those in the description of the YouTube replay. By the way, note for everybody watching, if you want to re-watch today's live stream, it will be available on my YouTube channel. On Facebook and Twitter may or may not be available. That depends on the platforms. But YouTube, definitely you will have the replay available. If by any chance there are questions that you put in the live stream that we didn't get to, if you comment them on the YouTube video, then we can reply to them. But if it's still in the live chat, then we can't. So please do comment them so we can go ahead and get back to you. But before we go, one last question, and this is from Rupesh on Twitter. He is asking, and I'm not exactly sure if this is your area of expertise, but do let me know if you have any thoughts on this. How can we use the power of artificial intelligence to cure someone who is addicted to drinking? So drinking alcohol, I would assume in this case.
So that's a good question, but actually not too difficult. It's all about changing people's behaviour, right?
Yes.
That's what we're doing. Addiction is obviously a nasty problem with its drugs, its alcohol, smoking, etc. Companies out there already are creating special devices, smartphone apps, for example, to reduce people's addiction to nicotine. We've seen that already being very effective. And obviously looking at the way you're doing things, how you're conversing, offering you CBT therapy as a way of overcoming some of the barriers of overcoming your addiction. So absolutely, I think these addictions certainly can be supported, if not helped, and treated by AI and deep machine learning. It learns about you, what the reasons why you're doing things, it learns from you on a day-to-day basis, make prediction models, and offer you therapy at the right time that you might need. That's what we're getting towards. And so I think addiction is going to be a hugely disruptive illness that will be supported by these technologies.
Interesting. Thank you very much for sharing. And one last question that I see from Lavi again. He says, how do medical professionals feel about AI and other emerging technologies? So what do your colleagues feel like about this tech?
So if you asked me 6 months ago, I'd say they're really scared. But things have changed. This is, as I said before, we've compressed time now in the last 3 months. People now say, actually, we can do this. Actually, we can do telemedicine. We can do things virtually. So they're thinking now differently. So the conversation now is much easier. People say, actually, we do need to do healthcare differently. I'm ready for that conversation. Also, the thing about it, Tanmay, is about language. Language of technology is scary. It has been for a long time. Yeah, lots of terminologies. People get worried about these. What is deep machine learning? What's augmented reality? They don't understand it. You and I are probably in that top 5 to 10% who will be pushing and driving innovation hard. Yes, we understand the language. How do you then take everyone on that journey with you? And my work around is about every stakeholder, every person in the healthcare system. How do you educate them into the digital conversation? How do you make it easier for them to ask the right questions? And that fundamentally is down to education. Okay, we need to change the way we train and educate the workforce so they're ready for the future. This is a platform. This is the new normal. We've already got a stepping stone, if you like. That wasn't there before. To make it easier. It's for us now as leaders who drive that conversation. So language becomes a part of every healthcare professional.
Amazing. Again, so as you mentioned, just a little while ago, they were hesitant, but now this sort of crisis has forced us to realize that, wow, we need to innovate, and this is something that is absolutely necessary. Thank you for sharing that. Now, as you know, the audience on Tech Live Skills is incredibly diverse. We've got a wide group of people here, all the way from developers to people who are getting into the world of technology to healthcare professionals and so much more. And so, before you go, is there any, would you like to share a closing message with the audience, something that you want to tell all of them?
Sure. Okay. So when I give my keynotes, I always refer to kind of two things, which I think is about inspiring others around you. So the first quote is by a guy called William Gibson, who was actually a Canadian-American writer who coined the term cyberspace that we all kind of use. So he coined the term, and it was this: the future is already here, it's just unevenly distributed. So our role is to distribute that innovation and technology much wider and more fairly. So I think that's absolutely true today. The last thing, which is absolutely pertinent today, was yesterday, as Tanmay mentioned, we saw the Falcon space rocket fly off with two astronauts, Bob and Doug, to the International Space Station. So that was an amazing time to be alive, to see that, to revolutionize the way we're going to manage space care. So the other thing I'd like to talk about is this whole thing about the future. The future is only limited by our sense of wonder and our imagination. That's what you need to come across. Think about the future that you want to create for yourselves and do that. Be passionate, deliver it. The world needs thinkers. We need exponential thinkers who are going to realize our ambition to make the world a much fairer place overall.
The world needs more thinkers. That is great to hear. Thank you very much, Dr. Shafi, for your thoughts. That was really insightful. Now, these are definitely testing times. They're forcing us to innovate, as I've mentioned, in fields like healthcare, so that healthcare is effective in times like these, just as it was before, and in fact is even more effective now with the power of this new technology. As Dr. Shafi said, we're seeing this huge shift within healthcare and within the medical field to telemedicine. We're using AI machine learning, for example, with that symptom checker, those chatbots. It's playing such a significant role in helping and augmenting doctors and surgeons and generally all these different healthcare experts in ways that we never could have even envisioned were possible just a couple of years ago. And so we should continue to work towards putting in the time, the money, just generally the resources to make this possible into research, into education, training more healthcare experts, and not even just healthcare, right? We want to train more people to be building this technology to help the field of healthcare in the first place. We need this, we need this innovation across domains. And only once we achieve these goals, only once we continue to put more resources into this research, will we be able to scale up this innovation. And essentially, we need to follow in Dr. Shafi's footsteps, right? We've got to continue to innovate, and we want Dr. Shafi to be the normal of the future. We want everybody to be innovating like this, just like Dr. Shafi is today. He's ahead of the curve, and we want to follow in his footsteps. So thank you very much, Dr. Shafi. Thank you very much to Dr. Halverstadt for actually opening today's episodes. Again, your thoughts were very insightful. It's an honor to have you on the show. And finally, before we close today, one more thing that I want to say is, again, that in a way, one of the morals of today's episode was don't be scared of new technology, right? Don't be scared of the language of technology. There are lots of different resources out there that you can use to get into the world of tech, whether it's VR or AR or AI or whatever else it is that you want to get into. You should be trying it out, and as long as you have that passion, you will find a way to get into it. And so once again, it's an honor to have you on the show, Dr. Shafi. Thank you very much, Dr. Halverstadt. I'm sure you're still watching, so thank you very much. And with that, I would like to close the 5th episode of Tech Life Skills with Tanmay. Thank you very much, everybody, and goodbye.
Thanks so much.
Bye-bye. And